This title, Three in a Bed, The Arts, Therapy, Politics, is a dedication to Still Point and a kind of homage, because these are the three disciplines or activities that are in perpetual intercourse in the life of the organization. I'm going to divide my time as follows. 10 minutes, something experiential. 30 minutes, my talk, which is heavily illustrated with PowerPoints, and 20 minutes for discussion. So let's start with something experiential that will involve the very daring and unusual maneuver in psychotherapeutic conferences of asking people in a moment to stand up and move around. Okay, there are three things here, three personifications in bed. Let's call them in a different order. Therapy, the arts, politics. I want you to show with your hand whether you identify first with therapy, then with the arts, then with politics. You don't have to be a therapist to identify with therapy, but basically I'm expecting that sort of limitation to be there. You can put your hand up more than once. You can put your hand up 3 times, but this will sensitize you and us to what the life of the group presently assembled here really is. So, first of all, who would identify with, want to own, put their hand up for therapy? I think it's important the organizers see this, because that is about 75 or more percent. Look around. Now, the arts. Who puts their hand up for the arts? And I think the organizers will be very pleased to see that that also seems to be around a 75%. And who will put their hand up for politics? A little less, about 45, 50%, something like that. Now comes a hard part. I'm going to ask you to choose and to form into groups. A group of therapists here, a group of artists in the middle, and a group of political people, politicians over here, stage right, as they say. You will have to stand close together, and that too is deliberate. So stage 1 of this bit of experiential stuff is to ask you to move and form 3 groups: therapists, artists, politicians. You must choose. You know, you don't have to be a group therapist or a dance movement psychotherapist to observe some difficulty in this, but that's okay. So I would just like the therapist group to say as one voice, "We are the therapists."
We are the therapists.
And do I have to tell you what you have to say?
We are the artists.
And
We are politicians.
such enthusiasm from the... Okay. Now, what I want you to do, as I ask you, is express a generalization, a cliche, a projection, an accusation, a comment, a headline about the other groups. So firstly, I'm going to ask the therapists, one at a time. They can't do this together because they haven't consulted. Only a few individuals need do it. Just to say in 1 or 2 words, a generalization about the artist. This is the therapist talking about the artist. What about the artist?
Flow.
Color.
Creatives.
Okay. I would like you to I would like you to finish the sentence. The thing about artists is fluidity.
Primary process.
Hmm?
Primary process.
Primary process.
Transformation.
Could you try to do it with a bit more of a characterization? It could be like the thing about artists is they're flaky, or something like this. Yeah, be rude.
They can't get up in the morning.
They can't get up in the morning. That's perfect. That's exactly what I want. Now I would like the therapists to say something about the politicians. The thing about politicians is... They what?
I was going to say they're corrupt and only look after themselves.
They corrupt and only look after themselves.
They wear dark
They wear dark clothes. Okay, dark, dull clothes. Thank you very much. Now we move to the artists. Finishing the sentence, the thing about therapists is they...
They're so isolated.
They what?
They're so isolated.
They're so isolated.
They think they know everything.
They think they know everything. Anyone else?
They get up in the morning.
They get up in the morning. So, dear artists, please do the same about the politicians. The thing about politicians is
They're assholes. The thing about
they're awful.
this particular thing about assholes.
They're awful. They're awful.
Not assholes.
What?
They're assholes.
Assholes. They're assholes. Assholes. Okay. Let's have a. I know you didn't say it. It's just that I don't hear very well. And somebody else would like to
The
say
thing
that
about politicians is they let their hearts rule their heads sometimes.
they let their hearts rule their heads. Let's just have one more. Assholes, hearts rule heads. Sorry, you.
They're very black and white about everything.
They're black and white about everything. Okay. So I think we've dealt. Now it's your turn, because you've been seriously smeared. So, politicians. The thing about therapists is
They're naive.
they're naive.
They need to go out from their room.
They need
Out from their room.
they need to go out of their rooms. Keep going, politicians.
They're repressed.
They're repressed. I thought they said you. Anyway, never mind. Any more?
They can be very narcissistic.
They're very narcissistic. They can be. Oh, so careful. They can be very narcissistic. Okay. So, dear politicians, the thing about artists is
Too much fantasy.
they have too much fantasy.
Too much rebellion.
They're unproductive.
Too much rebellion.
What?
Too much rebellion.
They're too much rebellion. They're too rebellious. Okay. How are you all feeling, by the way, now? You know, to be honest with you, if I had to choose, I'd rather be a banker. Sit down. Here's the structure of the talk. It's a typical Jungian talk. It has 4 sections. The first section is when therapists idealize artists. It's about the therapists who idealize artists as opposed to the ones who analyze and diagnose, which we just saw. And then something about artists and their ambivalence about therapy. Then I'm going to talk about political therapy and political art, which is the more intellectual part of this. And lastly, I want to expand the definition of art, because I think we've been talking about expanding the definition of therapy, and that's really important. And heaven knows I've written enough about expanding the definition of politics, but I haven't really given much attention, and I'm thankful to Still Point for the invitation to do so, to expanding the definition of art. My family were art collectors. We had a wonderful collection with all the big names of modern art. Unfortunately, due to a bankruptcy, the bank took them all, which is probably why I want to be a banker, because then I can get to see. And by the way, the main repositories of cutting-edge art in our day and age in the Western countries is actually in the boardrooms and corridors of banks and other financial institutions, which is deeply shocking, but there it is. I remember, aged about 8, being taken to the very first John Moores exhibition at the Walker Gallery in Liverpool, which exhibition, it's a competition actually, and it is by now the best known contemporary art competition in Britain. And because of the family's connections, I got to get a private view taken around by the then director, now dead, called Hugh Scruton. And we paused in front of a very splodgy abstract painting. And I said, as children of 8 do, I could do that. And he said, so do it. And I never did. This is about how wrong things can get when you idealize, you being therapists, idealize artists. It's a story about Jackson Pollock and the famous, now dead, Jungian analyst Joseph Henderson. Joseph Henderson was a very devoted and valued colleague of Jung. He was the very first generation. Anyway, in 1939, Joe Henderson has an analytical practice in New York City, and an alcoholic, withdrawn man called Jackson Pollock came to see him for analysis. It did not go very well. Pollock basically was completely silent, absolutely mute. And then Pollock had the idea that he would bring in sketches and pictures of what was on his mind, what he was doing in his studio in the Bronx at this point in time, because they weren't getting anywhere with an ordinary verbal Jungian analysis. Here's an example of one of the pictures, and I think you'll be able to see it's not what we usually understand by A. Jackson Pollock. What happened was this. They finished the analysis, or they did as much as they could possibly go, and Pollock left, didn't pay his bills, and left Henderson with 79 drawings, gouache, and paintings, which Henderson took with him as he moved around the United States establishing his practice. Pollock then died, of course, and in the 1970s, Henderson sold what are now called the psychoanalytic drawings of Jackson Pollock. For most of us, that is a deeply shocking thing to have done, and you can imagine, because it was Jackson Pollock in the 1970s, it didn't raise a little. It raised a huge amount of money, which Henderson did various things with, which are not germane to this story. The point about this account is that something that Henderson said about why he did this. He admitted this was not a good thing to do. And indeed, Lee Krasner, Jackson Pollock's widow and amanuensis, brought a court case against Henderson for selling her property. Henderson's defense was, no, this was clinical material and he was allowed to do what he liked with it. The judge said two things. I cannot find against Dr. Henderson on grounds of law. Therefore, the case of Lee Krasner is dismissed, but I can say, I don't think this is a very ethical thing to have done. And that's when Henderson said, yeah, you know, she was a woman judge, she's right. But I got caught up in an idealization, an idealizing countertransference of this great artist and his work. Here's another one. Now, this question of idealizing artists is a very, very big one. And yeah, anyway. I want to discuss a few things about why therapists tend to idealize artists. I once told an amusing story about how a patient of mine who worked in a bank invited me to come and see him at work on the trading floor of this city bank. And I thought, well, why not? Patients are always asking me to the first night of their play. Patients are always inviting me to the private view of their art exhibition or to see them dance. So I thought, okay, I'll go to the trading floor and see my patient at work. It's quite a story, isn't it? But it's also made up. I didn't. Yeah, I didn't. But when I tell it, everybody thinks while I'm telling it, it actually happened. It doesn't. Therapists don't go to the factories, to the stock exchanges, or even to the operating theatres where their patients and clients work. They tend to go mostly to people who are creative artists. And I think that is a very questionable state of affairs that can only be called an idealization. Another grounds on which therapists idealize artists has to do with the perceived bohemianism and freedom of the artist compared to the restricted, constipated, regulated life of the therapist. I asked Google to find me an image of a bohemian, and this is what they came up with. And this, yes, but I believe that something like this is what motivates the idealization that I'm actually bringing before you. The hair, the clothes, the ethnicity of the feathers on the earrings, and of course, the dope smoking. This kind of thing is grounds for idealization, but so too is this. I think a lot of therapists would like to be like this. And so their idealization rests on the rule-breaking behavior and the permission to break rules that they feel artists have. Now, by the way, if you are an artist or you know artists, you would find this a little bit questionable, but this, I think, is what's going on in the collective mind of therapists and counselors with regard to artists, which is why I did the exercise at the beginning to see how close this was going to be. Now, there is another side to this. Just as therapists idealize artists, artists are extremely ambivalent towards therapy. And they take up two contradictory positions. The first one is, I'm blocked, help. It's very hard to deal with that, but you get a lot of that in your practice. Writers who can't write, painters who can't paint, dancers who have psychosomatic illnesses, and on and on and on it goes. Help. That is one position that many artists have in relation to therapy. But there's another one, the exact opposite. I must stay away from a therapist because a therapist will rob me of my creativity. A therapist will give me interpretations that show how it's all about my mother. A therapist will reduce it to archetypal images if they happen to be a Jungian. Best to stay away from therapists. So the artists are very confused about the therapists, and the therapists are very confused about the artists. Just to deepen this a little bit, I want to talk about what is called the equus problem. Equus, horse, the play that I imagine most of you have seen or know about. This is the play in which a boy whose first sexual experience reveals his impotence, and he blinds the horses in the stable where it took place who witnessed it. And the psychiatrist starts to work with him and begins to have the gravest doubts about the morality and the ethics of work. This is what the psychiatrist says, and this is what I think those of us therapists who work with artists need to bear in mind. He will be delivered from madness, but what then? He'll feel himself acceptable, but what then? Do you think feelings like his can simply be reattached like plasters, stuck on to other objects we select? Look at him. My desire might be to make this boy an ardent husband, a caring citizen, a worshipper of an abstract and unifying God. My achievement, however, is more likely to make a ghost. Passion, you see, can be destroyed by a doctor. It cannot be created. Moving on, the next section, you may recall, was political therapy and political art. So many therapists want to be political. All the therapists in this room know how to say these days, I'm really interested in society, blah, blah, blah. And some are, and some really are not, but say they are. It's extremely difficult to marry psyche and polis, that means political society. It's very difficult to do. The profession is not, on the whole, supportive, and we lack resources. We lack books and papers about how to work with the political material the client brings, and we actually don't really know how to approach people working in the political world with offers of cooperation, as we were discussing in the question and answer of one of the previous talks. So it's very, very difficult to do this, to be a political therapist, not just pontificating about globalization or racism or all the terrible things that are going on, climate change denial and so forth, but actually to overcome the taboo about working systematically with these things in the consulting room. What can be done about it? What can therapists with an interest in politics learn from artists who are political? This is an image of a piece of feminist performance art from 1983. It's called Brides Against the Bomb. It was staged at a Campaign for Nuclear Disarmament festival at Glastonbury in England back then. And I'm very grateful to Rojika Parker for providing me with this image. Can you count how many issues are got, in the sense of captured, in this single condensed image? Women's relation to the public sphere, international relations, and defense. And the whole question of the meaning of marriage as the happiest day of a woman's life. In the written material for this performance, they refer to the making of a good marriage to a man from the Ministry of Defense. And in the performance, as it unfolded, a marriage ceremony took place in which a woman is married to a guided missile. The script says, missiles are not a necessity, but they're just there as part of a bad marriage. Now, clinically, I've had many clients, not only women, of course, who find themselves saying things like, I am married to a missile. You don't have to stimulate or foment or inspire such metaphoric image. Though people sometimes dream it, but it's very hard to know what to do with it. So that's why I turn to feminist conceptual art practices like this one. Such artwork performs an alchemical opus or work on images and experiences of the everyday and familiar, marriage, a wedding cake, and so on. In these works, there is a focus on the ordinary events and processes of the female body, such as menstruation or giving birth, showing how their everyday nature is also something special and especially conflictual. Isn't this what therapists do, actually? You work with the ordinary sacred and the sacred ordinary. So it's a very, very deep point that feminist art practices were making. The most famous one is called postpartum document, but it doesn't photograph very well because it consists of a series of nappy liners, diaper liners, stained, of course, with fecal matter, that the mother of her baby framed, wrote a few notes on them, and put on the wall of an art gallery. Extraordinarily popular and controversial exhibition. The point is that the knack of therapy is not to start with the big and make it small, but to start with the small and make it big. The everyday, the physical, and even sometimes the shameful aspects of ordinary life. Now, there's much more I could say about other sources of inspiration for therapists who want to work with the political than feminist art. Bertolt Brecht immediately comes to mind, but there isn't time to do that. Just wanted to leave that with you. Now, I want to move to the next section of the talk, which you may recall was expanding the definition of art. We began with when therapists idealize artists, then we talk about artists being ambivalent about therapy, and I've just said a little bit about political therapy and political art. Now we come to the question of expanding the definition of art, and I might need your help at this point. Art comes in many shapes and forms, but on the whole, sport, especially team sport, is excluded from formal definitions and understandings of art. And I want to show you a clip of a group, a team, doing something remarkable. This is the goal that settled the World Cup final of 1970 between Brazil and Italy. This is still spoken about today.
For Italy, I very much doubt it. They look very, very tight at the moment, Italy. They had a very hard game in the semi-finals against West Germany where they had to play extra time. And possibly having some effect on them now. And when Brazil get into a situation like this, they're very, very difficult to beat. Yes, it would be cruel to say it, but giving away a 2-goal advantage could only happen once in the 1970 World Cup, and we know who did that. I don't think Brazil are going to do it here. Erzino, faced by Facchetti. Oh, it's not a bad ball for Pele on the right side. It's Carlos Alberto. And what a great goal that was! Carlos Alberto.
It's better than Millwall. Continuing to talk about the expansion of the definition. By the way, who has seen this clip, this goal? Very few. Okay. Very, very few. And most of them women. Mind you, most of the people here are women, but even so, it is a spectacular goal. It's, I think, 8 players touch the ball, and it is passed 11 times. And Italy, who had the best defense in the world at this point, are absolutely ripped apart, and it's shown again and again and again. Anyway, this is now another angle on expanding the definition of art, and it comes from an exhibition that was here in London in 2013. Some of you may know it. It's about Ice Age art from 40,000 years ago. And it's basically called The Arrival of the Modern Mind. Here's an image from it. This is a pregnant woman. And the question that arises when you consider an image like this from 40,000 years ago is, why do people make art like this and record the ordinary events of their daily lives? Look at her belly, look at her breasts. It's really quite ordinary. And that's a very difficult question to answer. Why do people do it? As difficult is this question. Here is a totally symbolic figure known these days as the Lion Man. It's a human being with a penis, but also with the head of a lion. Why did people 40,000 years ago do something as symbolic as that? And if we think about these cave artists from so long ago, we need to remember that they were not professionals. And maybe we need to think about what has happened in art as it becomes more and more of a business. Has there been a déformation professionnelle, a professional deformation, or a deformation due to professionalism to think about? And having said that, I immediately think, isn't that also true of therapists and therapy? We have become so professional, so overregulated, so carefully insured with professional indemnity and malpractice insurances, so compulsorily forced into supervision, so state-regulated, that we too, like artists, have really lost something and have become deformed by our professionalism. I want to bring this to an end by really offering a kind of artistic comment on the therapy relationship. This is a clip from a Pina Bausch piece, and I'm grateful to Sissi Liku for alerting me to the relevance of Pina Bausch to a great deal of what we do as therapists. Pina Bausch and the Wuppertal Tanztheater are really seminal and critical people when it comes to this business of moving the everyday into the sacred. Pina Bausch was a great artistic transmogrifier, and she too was an alchemist of everyday life. She is interested in the flesh and in the soul, in the longing for love and the incurable sadism that comes with love. She makes pieces about the longing for predictability, but the suffering of crazy unpredictability and the general unfairness of life's relational mix of intimacy and isolation. The French have a word which they developed in relation to women, but I think it's dead relevant in relation to our world. Jolie laide, beautiful, ugly, the beauty that resides in a certain kind of ugliness. Let's not think about women, but let's think about the world. Jolie laide is what Pina Bausch teaches us. In this 1-minute clip, you're going to see something of the ritual and the repetitive circumambulation of the agony and ecstasy of relationship, of any relationship, and of the therapy relationship. What you're going to see is a kinesthetic practice grounded in the entire body and being of these dancers on stage. Isn't it also an emblem of what happens to two people in therapy? We could even say to the two artists doing their therapy together. I would like to ask you to watch with your bodies as well as with your eyes. There are no words, but there are sounds. They sort of made it. I showed this clip, which excites a powerful influence, at the Jung Institute in Zurich, and a very smart person in the audience said, "Show it again." Before showing the final PowerPoint, let me summarize what the intention of this extremely short talk has been. I wanted to bring therapy, the arts, and politics into an interesting juxtaposition. There are outrageous generalizations and omissions in the talk, but I do think there's something to be said about the rather disturbing idealization of art by therapists, and something to be discussed by therapists about the ambivalence that artists, in my view quite rightly, feel about what we have to offer them, despite the fact that they come to us desperate to be kick-started into their creative process once again. The relationship between therapy and politics is something that I don't want to go on about too much, because once I start I can't stop, but I do think that therapists can learn a hell of a lot from engaged artists. And by the way, artists who do political art are condemned by aesthetic, aristocratic, aged critics of art as not doing something that's really art, just as therapists who try to work with the political are condemned by their arthritic, creaky, out-of-date, frightened supervisors and seniors as not really being analysts. Finally, I wanted to end with these redefinitions of art that I showed you. I showed you the Brazil-Italy clip, and I showed you something about Ice Age art, which is in a sense democratic art. It's not made by trained artists, and that's what's so terribly interesting to me about it, because I'm also interested in what training has done to therapy and therapists. And then I went overtly to a piece of dance theatre, which I find illuminates many aspects of relationship generally, and also of the therapy relationship. So right at the end, here is a great quote from the divine Oscar. Thank you very much for listening.